It's 4 o'clock, so it's time for Got-IT Talks this week. It's my pleasure to this week invite you, Anders Tunold-Hanssen, to talk about, of course, again, the many inroads and challenges of modern digital life. But as I usually do in these Got-IT Talks, and of course you are new to this series, Anders, but of course allow us just a brief intro into, well, who you are and also why you are working with digital health.
Yeah, thank you for inviting me, and thank you for having the chance to talk to you. Because currently my life is very much focusing around digital health and the opportunities that give us now and in the future. But my background is from communication and marketing, and I was starting out in my career working with the retail sector. So I was working with groceries and other stuff in daily life, and also built up a couple of companies in that sector. And by coincidence, I ended up selling them, and I wanted to move away from that sector. And it happened to be then the IT sector that was the next step for me to move into. But still with a marketing and communication background. And I said to the ones that I worked for in the IT sector that technology is not my forte. I can communicate and I can kind of do the strategy. But as they said, they had a lot of technology people in there, so they wanted to have someone with a different background. So I said, let's do this. And that ended up with quite an interesting journey where I started out with general focus on marketing communication from the IT sector, but ended up as a marketing manager for one of the big companies in the Nordics, working in the healthcare and welfare sector. And then I was able to combine the healthcare and welfare, learning about the healthcare and welfare sector, and also, of course, learning about the IT. So that led me to being invited into a project that I'm now leading called the Nordic Interoperability Project. That is a project that is initiated by the industry, but has invited stakeholders from different parts of this healthcare and welfare sector, and focusing on the sharing of healthcare data across the region, and in this case, in the Nordic, quite Nordic countries. So currently, that's what I fill up my daily work with, is focusing on how to share data and share models and solutions across countries.
Well, interoperability, Anders, might not be the most commonly known word. So share with us, perhaps, for our listeners, viewers, in the future, what's behind the door of interoperability? What's it really about?
Well,
Just sharing the data like a good book club, or
if you go into the core of the core essence of interoperability, it's all about being able to share data across systems, and in a very common way, thinking about different systems being able to communicate with each other. Currently, that is one of the biggest challenges when it comes to the healthcare and welfare sector, since the different system being used in that sector doesn't have following the same standards, following the same guidelines, following the same rules, so that the data could be interconnected. So in a very simple explanation, I would say it's about the sharing and being able to share data across different systems.
for the purposes of simply the industry?
No, for actually for you and me, because the challenge of systems not being interoperable is the fact that the data you have in different systems is being locked down in those systems and not being able to be used whenever they are needed. So if an emergency happens or something like that, and you come to a new doctor's office or a new hospital, they will not be able to collect the historical data from you because the systems doesn't talk to each other. So yeah, So that's the easy explanation of interoperability, which is then a very complicated word.
So within that, what I mean, in a brave new digital world, we can plug in, we can set up databases to talk to each other. So all of this is, of course, that must be easy technically to do. So why do you need an interoperability project? I mean, surely you've got all kinds of Bluetooth technologies and so on. So what's the problem?
Yeah, and now you're addressing one of the things that I'm really concerned about is that when you and I look at the sharing of data in our everyday life, we see from very many sectors of our life that data is easy to be shared. We can connect and we can utilize different systems and we don't even think about it. But when it comes to healthcare, that doesn't happen. So they are a way behind. And of course, it's more complicated than saying, well, let's just share data. So interoperability is divided into different layers. And in the European Union, it's divided into them 4 layers, one of them being technical interoperability, making technology being able to share data across different systems based on international standards. That is quite easy to do. It's not a big problem. The problem is that you also have a layer of semantic interoperability. Words, languages doesn't mean the same in every region or in the interpretation of different words. So to be able to share the data, the same word must be interpreted in the same way. So even though we could be sharing data, it has to be then some kind of a semantic rule book on how to interpret different words in different languages or different regions or different sectors. And then on top of that, you have legal interoperability. Is it even allowed based on the legal issues to share data from one sector to the other, from one hospital to the other, from one hospital to a doctor's office? How is that regulated within a country, within a region, within a city, but then in my case also within different countries? And then you have, of course, financial or organizational interoperability. How do we finance all of this? How do we organize our healthcare and welfare system in such a way that a doctor's office is a doctor's office in every country? It might not be, because the responsibility or definition of responsibilities might be different. What is a doctor's office and what is their responsibility? What is the hospital's responsibility? Things like that. So when all of that is not similar in the different regions or where you want to share the data, then that has to be sorted out first. So working then on a Nordic basis on interoperability, we have taken the technological interoperability as a starting point, and together with different stakeholders in these 5 Nordic countries, also built a showcase where we then can be able to showcase how a future patient or patient of today for that matter is able to have a data in one country and being able to access that data in a different country when they go traveling. And with that showcase, that physical showcase, we wanted to start discussions on the other different layers of interoperability to push the envelope to actually make things happen.
Mm-hmm. Well, one thing you didn't mention in your 4 layers, which I find maybe also be interesting, I guess cultural interoperability. Would you say that that's just encapsulated within the organizational, or is this sort of a layer outside of those, the other 4?
There are different sectors that you can define as part of the different layers, but the European Union has defined them 4, and then of course governance and like steering up of these 4 layers as the basis.
Would you then say, I mean, as you said, the technical interoperability, that's easy,
Solvable.
relatively easy.
Relatively.
But your main focus is then on this sort of battling on all 3, 4 fronts, or where are your key focus at this point?
Well, all of these layers has to be kind of in sync to be able to have practical interoperability. And currently, there's a lot of people working on that. This is one of the hot topics in at least in the healthcare and welfare sector, based on the fact that we need to be able to share data more and utilize the data better. So there's a lot of people working on this on a local level, on a regional level, or on a national level. What we want to do is to, in addition to that, make sure that it's also being discussed how to share data across national borders while they are discussing how to share the data nationally or regionally. And some of the good ideas and some of the good solutions that might pop up on a local basis or a regional basis could be solutions that could be just as well fit for international sharing of data.
But it's probably not been a surprise when I say that there's a pandemic going on, Anders.
No,
You've
no.
noticed, I suppose. Um,
I've
has
noticed.
has that then been a sort of a driver or a delay, or how you've seen sort of the times that we live in? Has that affected your work somehow? I mean, there
Definitely.
has been a huge need, not necessarily of, I'm maybe contradicting myself here, but there's been a huge debate about the sharing of data um, within specifically to solve the pandemic itself, to also provide better clinical outputs. The data sharing that allowed the creation or the discovery or however you define it of the vaccines in record speed was of course one of the elements that where you can really see the benefits of data sharing. But in that other segment, I mean, you did not create the Nordic Interoperability Project to solve pandemics.
No.
So how has that affected your work, would you say?
I think definitely it has been an eye-opener into the possibilities and the need of modern technology to help out in such a situation. It's been it's kind of shown the best of possibilities when it comes to technology and the need of utilizing modern technology in such a crisis as it was, but also shown the worst of it, because it has also been showcasing the lack of systems and cooperation, sharing, all of that had to be put in place during the pandemic just because we had to. So in one way, we could have been better prepared. We could have utilized modern technology and digital solutions in a better way before the pandemic so that we could handle such a situation in a better way. But at the same time, it showcased how we were able to turn around and to utilize modern technology to the best for everyone in such a situation. But working then across 5 countries, being invited into different discussions in the pandemic, at least in the beginning of the pandemic, how to solve this, it was interesting to see that out of these 5 countries that I'm working with, most of them were discussing exactly the same things in different meetings, but I didn't discuss it together. So all of them had to come up with their solution and their digital solution on how to help their citizens and inhabitants in the best possible way, instead of putting heads across national borders together and solve it on a bigger, broader scale. Now, when I talk about, well, sharing of knowledge, sharing of data, cooperation, one of my perspectives is always that a lot of things is happening nationally. And then I'm addressing, then we should do this across national borders. I'm not blind for the fact that the European Union is doing a lot. So there's a lot of things going on. The only approach I have is that it's a huge leap from national initiatives to getting something done across all of the European Union. So that's also one of the reasons why this project is going on, saying that we could start out with 5 countries. The Nordics have a history of cooperation. We have a common welfare model that is more or less the same in all 5 countries. And we also have a Nordic Council of Ministers that is connecting these 5 countries together. So when we talk about the sharing of data, it's definitely needed to be shared outside of just 5 countries. It's just that we see that as a stepping stone. If we can make it there, if we can make these 5 countries cooperate better together, perhaps we could use that as a stepping stone to inspire others to do the same.
If you can make it here, you can make it anywhere. Oh, maybe
Perhaps.
not
Yes,
exactly, um,
more or
but
less.
from your experience of the pandemic, would you say then that you got um, that this was an eye-opening experience? That the discussions were held in a national. Or what were, if any, your surprises, positive or negative, for that matter?
I it was more or less more confirmation of what you expected it to be, but also then since we had run this Nordic project and for nearly 2 years before the pandemic hit, I had been involved in different discussions around this, and the pandemic just showcased the need of cross-border cooperation, cross-border dialogues, cross-border sharing of ideas. Um, to a much larger extent than what we have seen before. So I think that the pandemic really showed us the benefit of digital health and the possibilities of digital health and the importance of getting the individuals involved using digital health instead of meeting up at the doctor's office or meeting each other. Then we could reach out to them with digital solutions saying that we could help out in the situation we were in. But at the same time, then of course, the challenge of seeing then that the people were kind of thinking very national or very small. We could have broadened it out much further. But now I'm really stressed about not utilizing this aftermath of the pandemic in a most constructive way, because humans tend to forget quite quickly. We go back to normal quite quickly, and we should utilize the experience of a pandemic to kind of fast forward a lot of good digital solutions so that we are better prepared for the next pandemic, but also in general better prepared for the healthcare challenges that lies ahead of us.
Would you say that I'm used the word cultural, the cultural interoperability or the cultural challenge for interoperability? Um, People tend to forget. In the good old days, when you had a piece of paper that you had to bring from clinic to clinic, or from professional to professional, or across borders. Is it simply sort of also an element of the system resisting, relinquishing control, you think? Reproducing traditional cultural ways of s- of building silos? Um, I guess what I'm slowly alluding to, are you really the Don Quixote of digital health, fighting some windmills here, or are the windmills really true?
Now that this goes back to my background. I mean, my background is not technology or healthcare. It's marketing communication, and I think that the strongest asset I have working in this sector is that I'm a bit naive. I think it's possible because my logic tells me that this should be
Mm,
possible to do. This is a smart way of moving forward, but also because the need is definitely there. I mean, the challenges in the healthcare and welfare sector is tremendous, and they will be even bigger in the coming years. So it goes without saying that we have to find new ways of doing this. And it's a very interesting task to do or an assignment to have if you have a group of people and say, if we would redesign the healthcare and welfare system today, would we have built it in the same way? And the answer to that is definitely no, we wouldn't. I think the silos has come out of different reasons, out of different arguments and responsibilities, and dividing the tasks into different sectors and all of that. And then step by step, we ended up in the system that we are in now. But if we had been able to write the map once again, we would have put the patient in the middle, and then we would have drawn all the systems around the patient. And it would have looked very much very more different than what we have today. So I think that one of the reasons why it's so difficult to get the changes is that everyone is fighting the risk of doing anything wrong with what is defined as very sensitive data for you and I. So no one wants to do anything that is risking that, and for that matter, and for that reason, we get very slow in the development of the system.
But building it around the patient, thinking of the key role of the Got-IT project, that's sort of the impetus of these talks. Building it with the patients or building it from the patient and ground up. How do you see? I mean, I guess a lot of the stakeholders that you talk to every day would be data savvy professionals using fairly advanced vocabularies to describe how to make this technical interoperability possible in the future, and not necessarily at the same level as a lot of the citizens that this initially, ultimately would be for. Yet, thinking of the people that it's actually for, how do you see the role for these people to be integrated in? Are they the passive sort of recipient of your interoperability in the end, or how do you use the citizens or the patients as your co-creators in that interoperability?
Well, they are definitely not passive, and they should not be passive. The challenge is for them to have a collective voice in the system, because the way that we've built the healthcare and welfare system, at least in the Nordic countries that I know the best, is very much that someone else is taking care of everything for you. So the public sector is then taking care of it for you, and they lock in the data on your behalf. They don't share the data because they don't want to risk anything on your behalf. But have they actually asked the patients? And I think that anyone who is healthy would say it's of highest importance that my data is not for everyone to see on a daily basis. Ask the same person when they are seriously ill if that data would be helpful to in the situation they're in, if it would be possible to share the data, and they would definitely say yes. So I think it's also the patients and the individuals. You and I could be more involved in all of this, but we don't have a collective voice, so they need to be more involved. One of the groups or the groups that we reach out to is, of course, patient groups that represent a lot of patients that could help us in getting the right information about what the patients would like to have. But then we would also just talk to people being experienced as patients. But we should also define ourselves as individuals and be focusing on preventative care and preventative health when we are still fit. So they should be, and we try to include as much as possible dialogue with patient organizations, but the general you and I, being healthy persons, is a voice that is harder to get heard just because we are not very collectively talking in the discussions that is around health and well-being.
Patient organizations, for instance, would be one of those collective voices. Yes. But a similar situation or discussion could be had or have been had when we talk about organ donation or other stuff. Is there a way, or what's the key role or path to solve that conundrum? For organ donation, it's been for years a challenge that that everyone wants to have one when they need it. Yet for some reason it's tricky to get people to sign up for the donation, even appreciating that they don't have to donate until they're they can't really use it themselves anymore. How is there a better way to do that? Is that a legislative way that's the key focus here, a communicative way? What do you?
I think it's a very, very tricky question, because one of the reasons why we don't get involved in being active in how we want the world to look like when we turn from a healthy individual to a patient is because we don't want to think about it when we are a healthy patient, and we are focused on everything else. But the day that you turn from being then a normal healthy person into a patient having some kind of condition, then of course it gets very relevant in your life, and then you also get very much involved. So to wake up everyone before they come into a situation where they need the support as a patient or a patient group is of course difficult. It's really hard, and I don't have the answer to that. But I think that if you ask the normal people in the street whether or not, for instance, then their data would be available if they got ill or if they got in an emergency, I think most of them would say in 2021, of course it's available. Of course my data is available. So they don't know the situation that they will see whenever they turn into being a part of the system or the healthcare system. I think that is one of the challenges, is that we don't think about it as long as we don't need it. And I think that creating a sustainable healthcare and well-being system for the future, we have to be focusing more on keeping well, preventative care, being involved as individuals, doing what we can to secure that we could have a long and healthy life, and not just turn that over to the authorities to take care of us. But how that awakening should happen, I'm not sure.
But as you say, if you ask people, you would find that they had a positive attitude and would assume that it was already happening. So is that also part of the solution, that we should increase the, I mean, and especially in the pandemic, talking about healthcare systems, statistics around, well, infections, and I mean, there's been a huge increase in the amount of communication about health, healthcare, health systems, health policies, and so on. And of course, there are people that would prefer that that's changed into either something more normal or something less chaotic, maybe. But having public, a higher amount of more discussion about health issues, say, if we talk to people, why don't we talk to people then? Maybe is this something, I mean, looking at either the educational system, would it be if they had, I don't know, call it digital health on the curriculum? Is that maybe one of if you had a I don't know whether you got or wished for a magic wand for Christmas last year, Anders, but if you had one, would that be one of the elements that you could wish for, so that people would actually think about it or ask themselves that question, and then also maybe when their assumptions prove to be wrong, also choose to ask for that data sharing to happen?
Yeah, so that's a really big question, because I think that we should look upon health, well-being, also being a patient as part of life and as something positive that we would like to be involved in. I think that a lot of people are not getting involved in this or in discussions about the healthcare sector and the healthcare system and the situation how they would like it to be if they got sick, because they don't want to think about it. They don't want to be prepared for that. But since I've been stepping on this earth for some years now, I mean, reality hits. People around you are getting sick, they are getting chronic diseases, people are dying. So, I mean, getting sick, getting conditions, even death is also part of life. So having then a realistic view on what life will contain, both of positive experience, but also then health issues. If that is awakened and being kind of impacted to us on an early stage, of course, it would be easier to be involved in saying that life is about being healthy and having a good life, but also to be a patient and have a really good life. Because it's not like either or. I mean, we should live good lives even with conditions. So and we do, of course. A lot of patients do. That's a part of life, and getting that on the agenda so that people would be more open to talk about it. Also, when they have been lucky enough not to have a condition yet, I think could be really valuable.
I may philosophically be steering us a little bit off topic, but if part of the reason why we fail to understand the current healthcare system is also from a out of sight, out of mind a mechanism, is so that it's not necessarily that the healthcare system is not, if you will, doing what it can, but that the overall society forgets for as long as it can how the system could work or should work, and then in the end, once that you want to use it, then you discover. So should we have a wider discussion about health in a society in general? Would that also? You said before we have a tendency to forget stuff. Should we remember to talk about health as part of, well, life, as part of the challenges, so that we become better prepared, so that we can better understand how to solve certain issue also?
Yeah, I mean, the ideal would be that health and sickness would be a natural part of everyday life, and have the realistic expectations that things might happen. And for that reason, it's good to be prepared. It's not to be pessimist, to prepare for a situation where something could happen, making sure that you have your data available, that you can access the data whenever that's needed, things like that. So there's a lot of things to be done on preventative things. But you addressed also then if digital health would kind of be solutions for this, or have people involved. I would like us to come to a situation where we don't talk about digital health as something else than the traditional healthcare system. But currently, that's the new thing on the block. That things are moving into the digital world and being accessed through then digital channels. And of course, that gives us a huge opportunity to reach out to people and be close to people, either on their phone or on their PC, both with information of a healthy situation and a healthy life, but also be much more accessible. Since the old system, before we had digital solutions, then you were healthy until you went to a doctor and something was defined. Now the borderline between being healthy and being sick or being a patient could be more floating, because we could access digital solutions that helps us when we train, monitor our sleeping patterns, monitor our glucose meters, things like that, so that the borderline between focusing on health and well-being could be more accessible through digital health solutions.
So in the Nordic Interoperability project, how could you describe a number of ways where those realizations or those dialogues, especially what I'm, I guess, really referring to is the integration of those user input at various stages. How is that thought into the Nordic interoperability project to integrate either the actual input from the users or maybe at a meta level from user needs? How do you do that?
Well, currently we have different stakeholders that we involve in discussions, workshops to get input on the different work streams that we are currently working on. I think one of the work streams that we are working on now that would definitely be possible to invite and involve individuals in a broader scale moving forward is that we address the fact that we need better accessibility of digital health solutions to everyone, to the individuals. Because currently there's a lot of digital solutions out there possible for you and I to get hold of on different app stores, but there's little or no guidance to help us find the good ones. So a lot of the digital solutions being available is available, but there might not even be a company behind them anymore because someone developed that solution, they launched that solution, it's available for us, but it didn't take off. It was no business model or no interest to follow that up from the developer side over time. So they found other things to do. And the app is still there, the digital solution is still there, but it's of no good use, and it might even be risky to use because the data could be shared or end up in wrong hands if you start using them. So to get access, to get people involved, we have to make sure that they have easy accessibility to digital health. So what we have to do is to get them aware of the opportunity of digital health. When they are aware of the many digital health solutions that they might access and might use, then we have to make sure that it's easy accessible for them. And when they are aware of the digital health solutions and it's easily accessible, they have to trust the source so that they actually are willing to start using them for their own health and situation, but also then perhaps being able to collect data, have historical data to be able to be using whenever they need it for a healthcare situation. But then we have to have solutions that are safe and trustable, and that has to be monitored over time as well, so that someone is looking after that for us. Currently, the individuals is a wasted resource in the digital healthcare system, because currently we are just pushing most of the individuals to the general and generic app stores where they can find a solution that they think looks fun, but we give them very little guidance to that this is actually a good solution that could be integrated into the traditional healthcare system in such a way that you and I could be resources in the full picture and not being just collecting data for fun. And I would like to see that. I would like to see the individuals being a part of the total picture. Also when it comes to preventative care data, collecting the data, but they have to use it in solutions that we trust in, and they have to collect the data in a way that is good, and then that could be an active part of the total healthcare picture. And that's one of the things that we're working on now, is to look into, could it be possible for the Nordic countries to end up with a common solution for how to evaluate digital health and be able to communicate that to the individuals, that these solutions could actually be good using and you can trust them. And the reason for doing that across countries is also because looking at it from a traditional healthcare sector perspective, you just need a good solution. But we have to at the same time look at it from an industry perspective, that we give the developers, the startups, the creative people, the ones who have the good new ideas, a big enough marketplace for them to have a business model that makes it live for longer than just the first 3-4 months. And then we need bigger marketplaces than one country can provide for themselves. And in that whole picture, then I want individuals to be even more involved than what they are today.
A thing that we've looked at in the Got-IT project, thinking of your point about using it for 3-4 months, there has been some that have looked at health apps and have lamented that well, there's a lot of digital solutions being produced, and then people download them, but they don't use them very long, and therefore they must be faulty. They should have been designed better for people to use
Yes.
them continuously. But what if I mean, it is a rare find, even at a personal level, that you find things or people that you want to be with for your lifetime. It is not it's not always that things work out. But if the perception of a digital app, for instance, was that what you used it for would be to download, to monitor some element of your lifestyle for a couple of months or even shorter. And once you had that information, you could assess whether you needed to, wanted to change something, and then maybe the 6 months later you could do it again to see if the change that you decided to do actually had been well implemented in your life. Then, if that was the use scenario, then an app that you downloaded and used for a shorter period, and then stopped using until you again maybe monitored yourself later on, that would be actually a well-functioning app. Um, is it sometimes when we try to talk about digital health solutions and see them as faulty if they are not used continuously, that we are raising our expectations as to how well you can design stuff? Even, I mean, whether we talk about clothes, cars, most things in our lives, we don't use them necessarily continuously. We grow tired of them. We want difference. We want change. We want so so. Is our perception of what's possible in digital health also slightly awry? Or would you how is it should it be possible to have I'm not sure if that's the right phrase, but I'm thinking of sleeper apps. That sounds sinister, but that you can can you really design digital tools in such a way that that is realistic for people to actually use them for years and years?
Well, currently no, but currently we are in the race of the innovative and the startup phase of digital health as well. So currently there's a race of a lot of startups, a lot of industry players developing different kind of healthcare apps, and there's tons and tons and tons and thousands and thousands and thousands of solutions out there. And that won't be the situation in years to come, because we as humans and our nature is that we will select the ones that we feel is the best for us, or that being recommended by others or that others are using. So there will be a lot of those digital health solutions that we see today that will be merged into bigger solutions and better solutions and more complex, or solutions that cover more of our everyday life, so that we can select using them for a broader perspective of our life. At the moment, it's a very, very fragmented market. For any small thing, there's an app, and you and I will never be able to use all of them. There's a lot of merging going on. There will be a selection of apps that will survive, or digital health solutions that will survive, and they will be bigger and they will be better connected and all of that. But what you're addressing is that I think you're very right. We get tired of things and we want to have something different, and our situation is changing. And that is also when we are working now on how to evaluate and guide people to quality solutions in quality apps. We have also taken into account the interoperability spectrum of that, so that we also look into how could we make it possible for people to be utilizing an app for a while, and when they leave that app, being able to bring along the data collected in that app to a different app, to continue the journey with a different app, being able to have the historical data that they've collected with them for the next app or the next phase. Or if you want to collect your data, your training data or your health data over time, that you are able to take that data and have a constructive dialogue with your doctor or the hospital if you come into a situation where they need the data, so that it's able to transfer the data from an app to the traditional healthcare system. Or even more exciting is if we could have a lot of good digital health solutions, apps that collect preventative care data that you and I could donate into, for instance, a preventative care data lake, where that data could become to use also for research and innovation purposes on preventative care. Because currently, most of the development of new solutions and health solutions is based on patient data collected when we have been defined having a condition of some sort. I would also like us to look into how can we collect quality data on the preventative care side that could be used for research and innovation purposes. For the betterment of you and I mean, then we are resources in the whole healthcare spectrum, instead of just being passive receivers of healthcare treatment whenever we get sick. I want to be a part of the system. I don't want just to be taken care of whenever something is happening. I want to be active part of this.
A positive co-creator of new solutions.
Yes.
But you point to, of course, also this evolution, the evolutionary stage that we're at, where we are talking a lot about how can we produce better digital solutions of various kinds, and that it's tricky and it's chaotic and it's challenging. But if this is a true ecosystem, Darwinism will solve some of those elements for us.
Some of them.
So is it also a matter of us being slightly impatient? We want the future and we want it now, where we should just let things slowly evolve, and at least, of course, fixing or making sure that there's both a data security and a data interoperability. Then it's also a matter of patience as well.
I said once that in the future the patients won't be so patient anymore. And I think it's I often tend to say that for any one of us who is working within the healthcare bubble, it's easy to list up a lot of reasons why it is so difficult to have more effective solutions, and at least when it comes to the availability of data or healthcare data. We can list up a lot of reasons for that, and a lot of reasons why this will take very long. But individuals, they are not within this healthcare bubble. They are individuals, and they see life from different perspectives. And they see that they are sensitive data. And my example is always bank data. My bank data is available wherever I am. I can go to a mini bank wherever in the world, and I can check the status of how much money I have in my bank. That in my life is also sensitive data. But that's being able to be shared across systems and being available for me anytime, anywhere, either on my mobile phone or on digital solutions. So I see as an individual that data is being available across systems in other aspects of my life. So why shouldn't it be possible within the healthcare sector? I mean, so the patient won't be that patient for much longer. They want to demand that modern solutions is also coming into the healthcare sector, and for their own safety. They won't be living with the fact that the data is, I mean, as a severe patient, if you travel across national borders, you do it with life at stake because the data is staying behind. why should it be like that? Why should we patients be so patient and accepting that?
Which may sort of point to that now that patients are becoming impatient. That is one of the key solutions, maybe that as long as people were patient, um, there wasn't actually any particularly need to change stuff, because, well, who would actually ask for anything different? But now that they're becoming impatient, this is actually a needed element for a very useful innovation in terms of quality, accessibility, interoperability so while I know that some healthcare professionals, I suppose, with the typical would be the doctors that were slightly frustrated about patient asking Dr. Google again and again, and then challenging them on certain stuff, but they should actually find it. They should appreciate the co-creative patient that is now challenging and thus paving the way for the next evolutionary stage of healthcare.
Yeah, and I think we can come up with, if we co-create, if we get involved, if we get the best heads together, having the voice of the patients or the individuals and what they need and how they need it, and getting the best technical guys to develop things, we could have something better than Dr. Google. I mean, Dr. Google is not a good doctor. So there could be better solutions. But in lack of better solutions, Dr. Google is handling a lot of stuff for us, scaring people. If you haven't been feeling ill before, then just try Dr. Google and read a little bit, and you will find that you have a lot of stuff. But I think it's one of the reasons why it takes time and that turns out to be more and more challenging is the fact that technology and the technology development is moving in a tempo that you haven't seen before. I mean, it's not more than 20 years ago since we were afraid whether or not the world would stop at the turn of the century or the millennium. And since then, the technology has just developed in a huge speed. But at the same time, our political system is still the same. In my country, Norway, we have elections every 4th year. So within those 20 years, we have 5 elections. But the technology have raised tremendously. So a rather slow political system, trying to stay on top of this race of technology, that gap between the technological possibilities and the political system, that is just getting bigger and bigger. And I think that the biggest fear I have is that the technological possibilities is not being, well, it's hard to stay on top of that and utilize that in the best possible way, because just in 6 months, 1 year, there will be a lot of new technological opportunities to be used. But in the public healthcare sector, at least, it takes a long time to get a system implemented, getting used to that, getting that into operations. And that's a big challenge. It's a huge challenge.
I used the phrase of a magical wand earlier. But thinking then of digital developers, either, I mean, the actual programmer herself or himself, or for that matter, companies or large or small, what would be some of your key advice when we talk about that role of the impatient patient, the co-creation part? What would you try to advise them on, if you could share 2, 3 from your experience, on how to best navigate, utilize that asset?
Well, I would say, going back to something that you addressed in the beginning, what did we learn from the pandemic? I mean, one of the things that we learned is that it is possible for the society to move quickly into modern solutions if we just put the best heads together and cooperate across sectors and across kind of industries and interest organizations, all of that. When we just see that we have a common goal that we have to solve, it was possible for society to kind of handle a pandemic that, if you're talking about it before it happened, we would have said that. I mean, if anyone told me that in the beginning of 2020 that in 3 months' time we will do a big global pilot of closing down all the travels, everything, everyone would stay at home, I would say that would never ever happen. It wouldn't be possible. It wouldn't be possible to stop the world in that way. We did, and it worked. And we got out of it in a good way because we worked together and we put the best heads together and all that. So, if anything, the pandemic should give us a lot of hope and a lot of inspiration that a lot of things is possible to do if we just look a little bit away from the traditional way of doing things, putting everyone, not everyone together, of course, but the different stakeholders, put them together and let them create and co-create together, and we can develop new things in different ways and in better ways than what we had before. In the pandemic, we had to go across the traditional ways of doing things because there was a need to get things done. That need is still there even though we don't have a pandemic. So we should continue to create a better solutions for the healthcare and welfare sector and for the individuals based on the same kind of sense of urgency that we had in the pandemic. The pandemic showed that it was possible. So now we should just continue doing a lot of work in the same way.
And then I know, well, quite briefly, maybe Anders, if you had a similar request or wish to some of our political stakeholders out there, what would be a thing you could wish for that they would do and in the coming months, years, to focus on?
Well, I think that political system is moving in the right direction. I think they are thinking smart things. They are looking at the right kind of solutions, but they have to move. They have to speed up. They have to move faster forward. We've just come out of a pandemic, but we have a big health crisis ahead of us when it comes to the situation of the wave of elderly people being more in need of care. We don't have that many warm hands to be working in the healthcare sector, so we have to find new and better ways of doing things. So the sense of urgency is one of the things that I would like the politicians to kind of be focusing on. We just had an election in Norway. They have now been in office for 2 weeks. They still, of course, should be able to think about what they want to do. But they're currently saying that we want to create a report on this. We want to put down a group of thinking about this. And it's like, another report? Is that what we need? Could we get some action done? So,
a little less conversation, a little more action, please. Yes. Well, thank you very much, Anders. It was a great conversation with you today on the Got-IT Talks, and I look forward to collaborate with you in the future to co-create some good solutions again. Thank you
for having me.